Good morning and welcome to, doesn't seem like it's going to be the series on sleep now that we've transitioned over. Looks like for the next few talks, we're going to be talking about our gut and our digestive health, starting with today on the leaky gut, the inside story. So just to start things off, of course, as a disclaimer that this is not meant to suggest a cure or treatment. This is also not meant to diagnose. The intention of this presentation is to inform and to educate. So just a bit about myself. My name is Dr. Romi Fung, and I'm a practicing naturopathic physician in Richmond, British Columbia. I hold a general practice with a focus in Alzheimer's disease and dementia. I did my naturopathic medical training at the Canadian College of Naturopathic Medicine, and prior to that, did my pre-medical training in Simon Fraser with a Bachelor's of Science in Health Sciences. And I'm just looking at the date here, May 25th. I'm counting down the days that I have to finishing up this master's in aging and health from Queen's University. And I'm pretty sure there's a few of us in the audience here that's also cheering alongside with me in regards to finishing this off. But I had the opportunity to share some of my research to my colleagues regarding the use of curcumin in the treatment and prevention of Alzheimer's disease and dementia. And I did promise that I'll be sharing that. Maybe I would later on this week in regards to Naturopathic Medicine Week. So stay tuned with that. So because we're talking about the gut, and the gut is probably the first thing that I always have to consider as a naturopathic physician. There's absolutely so much that can go on with the gut. And even though it pertains to the gut, it can affect a lot of our health systemically. So it can affect other aspects of our health, whether that be cardiovascular, so the heart and the blood vessels, or neurological, so our brain. There's so much about it. And this makes so much sense to actually start off with leaky gut, whoever actually recommended to do leaky gut first and foremost. So I'm really happy and really excited to be sharing this with you today. So why don't we get started then? I like to start off with this quote here by Hippocrates, who is the father of modern medicine, that he states that all disease begins in the gut. Now, do you find this to be a correct or true statement or not? Because Hippocrates, I believe, existed in about 400 BC. So that's approximately 2,400 years ago when he made this statement, just by observing his patients and his research or his studies on the human body. And now we've come 2,400 years later, and now saying that, let's look back at the gut. So first off is, what is the leaky gut? What does it really make you think of? As it states, something is leaky, and that's probably the gut. But what is it about the gut that it's trying to describe or trying to refer to? It's referring to the barrier in the gut. Now, for the past couple of decades, it hasn't been quite accepted by conventional medicine. But in the past few years, otherwise, this understanding of what it means to have a leaky gut, or in medical terminology, something called intestinal permeability, meaning the gut is becoming very permeable, or that things can actually pass through. Now, when we think of passing through, we remember doing this back in high school. We talked about something called osmosis, the passing of water through a membrane. And so with passing through a membrane, it tends to be very passive. And so there was kind of that discussion that that doesn't quite happen in the gut. And it doesn't actually. So something else has to give in order for something to pass from the gut into the body. But talking about this barrier itself, this is what we call the intestinal epithelium, or the intestinal epithelial lining. So this is that barrier that separates the host from, everything else, the environment. And we're finding that in conditions that are pathological, so conditions that bring up disease, it's this permeability of this lining that may be compromised. And once this lining is compromised, that allows the passage of everything else that can come from the environment, including toxins, bacteria, undigested food. And when that enters the body, that goes into the blood. And that's what we're kind of referring to as the leaky gut. And it's this leaky gut that allow other things to harbor and can trigger many things down the road. And we're going to be talking a bit about that in the next few slides. So before we actually get into the meat of this, we kind of want to get some context as to how much the gut can really control and how much if one part of it is permeable, how does that really affect everything else? In other words, the area of the gut. So ask yourself, how much of this lining is actually covering the gut? And before we can even answer that, we need to ask ourselves, how long is the gut? How long is the intestine? Give you a quick 10 seconds to think about. If I were to take this gut shown in this picture and just stretch it all the way across, how long would that actually take? Now, even though I went into medical school, I had to look this up. And what I found was it's about 6 meters long if you were to go from one end to the other of your small intestine. And it's, even though it's 6 meters long, we still have that tube, that lining that we still have to unravel. So if I made that kind of cut along the length of this tube and unravel it, then we get something called the surface area. And with the surface area can tell us how much of this area is being exposed to our environment, and thus how much can be at risk when you have that intestinal permeability. So with the unraveling of that, you also have to take into consideration something called microvilli. And these are particles, these are like finger-like projections that really increase the surface area of what's inside the gut so that you have more absorption going on in the gut. So taking that into consideration then, you have what you call a badminton court, and it actually, on average, the digestive tract averages about 32 square meters. So that's about half of a badminton court. So the next time you actually play on a badminton court and you take one half, just look at the full border and think to yourself, this is how much is being exposed in my body or in my abdomen to really aid in the absorption of nutrients and also digestion, amongst many other things. It's quite a picture to think about, but that's how much our body tends to work, absorb, digest, assimilate, and so forth. So looking at this whole surface area, we're going to take a closer screenshot at kind of like the cross section of one of these cells here. And what you're looking at here is On the right side is something called the gut lumen. So that's inside the gut. And then here you have the barrier in the center. And then on the left side is what enters into the body. And so you have all these food particles, bacteria, viruses, etc., and so forth that inhabits the gut lumen. And you have to, or the body has to selectively figure out ways to really absorb specific nutrients to get into the body for your body to utilize. So in the aspect of leaky gut, then, how is it that one can become leaky? And this has to do with something up here called tight junctions. Tight junctions is actually kind of like the glue that you use to glue tiles, for example. If you're tiling your bathroom and you need to use the adhesive glue, that's what the tight junctions are. Sorry, give me a moment here. Looks like my body's still waking up here. But it's that when the tight junctions don't function as well, if they don't glue the cells together, it's going to leave holes. And that's where things can start to leak into the body. As you can see, kind of like right here where I'm pointing at with my cursor. And because you have these things leaking here, right underneath these cells, you have pretty much your immune system. About half to maybe 60% of your immune system lies in the gut. It's kind of like your checkpoint, your security checkpoint. Sorry about that. And so if you're having undigested foods coming into the body without properly being absorbed by your other cells that line the gut lumen, well, the body's going to start seeing it as foreign. And when it starts seeing it as foreign, it's going to want to gather all of its immune cells, so all of its security guards, to make sure that it's either safe or not safe. And the problem arises when you start to recruit all these immune cells, because the immune cells are not just immune cells, and that if they come into one area and they don't see anything wrong, that they just disperse and not care about anything. In fact, they're quite damaging. And so even if you recruit them and nothing is actually kind of in need to be addressed, whether it's something that is invasive, then the immune cells still come to the area, but then because they affect their own environment or what's around them, that other cells around them get affected because they release a lot of other signals that can digest certain things along its path. And so we're going to talk a bit about that too. But looking closer, it's about this tight junction that's just in between all your epithelial cells. And it's if you do damage this area here, that things start to leak. You don't have to worry too much about the names right here, but there's a lot of other proteins and signals that are associated with keeping these tight junctions tight. Hence the term tight junctions. So when you do have things that leak into the body because the tight junctions are not functioning at their optimal state, then a whole lot of things happen. Especially when it comes to the fact that if it's the immune cells that are being recruited, in order to recruit immune cells, you also need to recruit inflammation. And so chances are, if the gut is inflamed because of this recruitment of the immune cells, then your body itself, systemically, so your entire body, can potentially be inflamed depending on where it goes. So this is where we get into, well, what am I going to be seeing if this tight junction is not functioning properly? One of these symptoms is memory loss, with the second one being brain fog. So what I like to say to a lot of my patients with coming in, working with brain health, dementia, and so forth, is that if your gut is inflamed, chances are your brain can potentially be inflamed. And that's because if this systemic inflammation travels up from the gut to the brain, well, your brain's going to have to start fighting off that infection too. And when that infection, or when that infection gets to the brain and the brain sees it as foreign, it's going to want to protect itself by becoming inflamed. But with this inflammation comes the fact that the brain's own protective mechanism, something called the blood-brain barrier, BBB for short, becomes even more porous. Because the brain actually has this barrier that prevents almost everything, 99% of things, from entering the brain. And there are many studies out there that are trying to figure out which drugs can actually enter the brain for effective work. Because even though there are a lot of drugs that are being made for, let's say, dementia or headaches and migraines, the first thing that they have to worry about, besides absorption, is will it be able to get to the brain or through the blood-brain barrier? But if the blood-brain barrier becomes porous, well, everything is going to start getting in there. And that could lead to some signs and symptoms of memory loss and brain fog. Because there's a burden going on in the body, because the body's constantly processing its daily needs and daily needs of activity and such, that anything additional can lead to a greater burden. Now, of course, the body is very resilient in itself, and that it will help itself make sure that these things become addressed. But if this happens over time for a longer period of time, it's going to start getting burdened, because we have something called the allosteric load. And that means that we have a kind of like a capacity as to how much our body can take. And if we hit our tipping point, that's when things start to shift, processes start to shift, and that the body has to start allocating or prioritizing where it needs to allocate its resources. This can lead to fatigue. We talked a bit about the brain, but a lot of symptoms of leaky gut can lead to headaches and migraines, especially when it comes to food sensitivities, which we'll be talking about. And if the whole body is going to be inflamed because of the gut, it can irritate a lot of joints. And if your joints are not properly lubricated and protected, this can lead to joint pain. I like to say that the skin is a reflection of what's going on the inside. So working with psoriasis and eczema and rosacea and such, even though we have a lot of things to utilize when it comes to topicals and creams, if we're not really working with what's going on the inside, it's not going to be effectively treated. And that's why I see that skin is a reflection of what's going on the inside. And we know that if things are happening on the inside, leading to this leaky gut, a lot of that inflammation is then going to approach some of the skin and could actually irritate it. And then we have our typical digestive symptoms, not just chronic diarrhea, but constipation, indigestion, stomach acid, etc., and so forth. These could also be part of this leaky gut picture. Now, this is not just all of the symptoms. This is most likely the most common ones that you'll find. So knowing with what we see with leaky gut, how does that, or what contributes to leaky gut? And there's actually quite a few things when it comes to what's in our environment. The most common thing a lot of people think about when it comes to leaky gut is gluten and dairy. And for good reason. There's a lot of, or a growing amount of evidence that shows that something in gluten, which is called gliadin, now that's the protein in gluten, has been found to stimulate the release of protein, something called zonulin. And it's zonulin that can lead to this permeation, so this destruction of the gut lining. And now we're finding that there are tests that can actually test for zonulin, specifically in the functional medicine route. So you would likely have to see a naturopathic doctor versus a conventional doctor to get this requisition. But there's a growing number of tests that really show how much is going on. But there are other things in our environment that can really contribute to leaky gut and almost, you could say, breaking down the tight junctions. Some of them being acid blocking medication. So your PPIs, for example. Alcohol consumption, definitely if it's uncontrolled. Antibiotic use. Environmental toxins, including PCBs, so coming from plastics, mercury, pesticides, herbicides. Too much animal fat consumption can also contribute to that. High fructose corn syrup, that's what we call sugar. Extreme amounts of sugar coming from our commercial goods. Immune suppressing medication. Current infections, including something called SIBO, small intestinal bacterial overgrowth, which we're going to be talking about next week in regards to irritable bowel syndrome, IBS. But also other infections that are not controlled, such as viral, parasitic, and yeast infections. Stress is a big thing, and it can actually affect our gut lining. Have you ever had that moment where you had an acute amount of stress, whether that be a very important meeting or an exam, and you just had to go to the bathroom and out came diarrhea? I think for me that happened quite often during my medical studies, and it really got me thinking about this stress and gut connection. And the use of NSAIDs, so pain medications such as aspirin, ibuprofen, and naproxen, these can really affect our gut lining, especially if you use them on a very long-term scale. So thinking about leaky gut, I also think about food sensitivities. And if any one of you has ever seen or heard of naturopathic doctors, one of the most common tests a naturopathic doctor might likely do is something called a food sensitivity test. And food sensitivity tests indicate how much your body is reacting to a specific food protein. And so this is a simple blood test. And what it tests for is one component of your immune system. So there's different antibodies. You've heard of the term antibodies likely. There's different types of antibodies. For example, the antibody that's governed by our allergies, especially the anaphylactic shock, where if you eat a peanut and you have the swelling in the neck and you're forced to go to emergency, that is governed by something called IgE. This test, however, is not a food allergy test. And we're going to go into those specifics in the following week after when we talk about food sensitivities, allergies, and intolerances and the differences between them. But listen to this now and just understand that this is what we're testing for is something called IgG. And IgG has a half-life of about 20 to 30 days. So I'm going to say 1 month. Meaning, if you react to a food, and let's say you have a numerical at 100, in about a month, you would have half of that response, so 50. And in another month, you would have half of that response, which is 25. And then another half onwards would be 12.5. So what that means is when you have something that reacts to a food particle, it's going to stay in you and it won't be cleared until about likely a few months down the road. But that also depends on how strong that reaction was in the first place. That's why some people are very sensitive when they eat something, some people are not. But why do we talk about food sensitivities in leaky gut? And that's because if your body is leaking food into the, or if the gut lining is not strong enough and thus food is leaking into the body, one way is the body is going to respond to those undigested food particles with their IgG antibodies, and you're going to get a lot of these results in this test being likely red, yellow to red, because their response becomes much greater. But even in a healthy body, you can still potentially get food sensitivities because repeated exposures allow the body to say, hey, something's coming quite often. We need to get this checked more often. And so the more a specific food particle comes into the body, well, the more the body's going to recruit its immune system. And that leads to an increased number, as you see right here, an increased response to that food particle. But if you're finding that a whole bunch of these, now this test is, I think, 3 pages long, but if you're finding that a whole bunch of these food results are red, then chances are you're likely leaking a lot into the body. Whereas if it was just, just a few red and yellow ones like this one right here, what I might be seeing is that you're probably just eating too much of these foods in one time or too often. I have this one really silly example, but I have one of my patients. He's a nice, jolly fellow. He's really burly and big, and he actually had a history of bodybuilding and anabolic steroid use. But when I did a food sensitivity test on him, it showed that his egg white was about 200, 300. That's extremely high. And so I thought maybe he was eating, 3 eggs a day for, X number of years. But when I inquired, he was like, oh yeah, in my bodybuilding days, I ate, a dozen eggs a day. I thought to myself, okay, my guess was pretty bad. But that tells me otherwise, that it's that repeated exposure of the same foods that can really upregulate your immune response to these specific foods. And so food sensitivity testing can then be done. But if several of these foods are high, then chances are your body is not selectively absorbing them in a way that, with the leaky gut, things are just kind of almost spewing in without being kind of considered at the junction or at the barrier. So one of the big things with leaky gut has to do with autoimmunity. And there's something called the triad of autoimmunity that requires a leaky gut. So when we think of autoimmune conditions, I think of conditions such as lupus or Hashimoto's thyroiditis, type 1 diabetes, and so forth. But in order to put yourself or your body in a state that is prone to autoimmune conditions, you need to have the genes for that, or a genetic predisposition. Because, I mean, life gives you a deck of cards in the way of your genes. So it's really how you play your hand that determines your gene expression. Next off, you have a trigger. It can be environmental, as I wrote here, but it can be also physiological or mental. So a trigger can be like an event. It could be a cold, it could be a flu, it could be trauma, it could be emotional turmoil that really does you in. And having that leaky gut, it's kind of like having the leaky gut as oil, for example. And that environmental trigger is a spark. And if you have the right genetic predisposition, that if the spark hits the oil, then flames will come up. And hence the triad of autoimmunity. Now, with autoimmunity, especially when it comes to Hashimoto's, there has been some links that are well into this literature. One of them being that there's protein in dairy, which we call casein, and that we mentioned gluten, but specifically gliadin in gluten. These two cells actually resemble very close to a thyroid cell. And so if you have a leaky gut and you're leaking in a lot of the gluten and dairy cells, that there could be that risk, that chance that if your immune system is overworked because the leaky gut is putting your body into overdrive, into a lot of burden, that it could potentially get quote unquote confused and tag its immune cell on something that's similar to a thyroid cell and thus starts attacking a thyroid. And that's one of the bases of Hashimoto's thyroiditis. And that's why with Hashimoto's and other autoimmune conditions, that one of the first things you want to be bringing out is, or removing, is the gluten and the dairy, just to ensure that not only are you reducing the risk of that attack, but to also lessen the burden, which we're going to talk about as to what we're going to do when you suspect that you have a leaky gut. And so when it comes to approaches with leaky gut, it's not really simple, and it's very, very comprehensive, because it's a all or nothing type of thing. There's never going to be any gray component to leaky gut or to the response in leaky gut from the immune system, because it's either you don't expose your body to the trigger and thus your body does not respond to it, or even if you have just a tiny bit of it, it's going to say something's there, we need to send it out now. So it's an all or nothing type of thing. So you can't just say, well, I'm going to reduce half of my gluten intake. Likely that might not be doing much, if not nothing at all. But the approach here I'm talking about is something called the 4R approach. Now, the 4 R's include remove. So removing all inflammatory foods that can really damage your gut. And that includes gluten, dairy, corn, soy, eggs. Those are the 5 most common things. And if you've ever heard of something called the elimination diet, they ask you to remove all of these all at once. Now, for my patients that we go through this and are unwilling to go to remove all of these foods because it's just too challenging and too difficult for them, that's when I'll suggest doing the food sensitivity test to ensure that we just remove the ones that are likely more reactive and thus can then damage the gut. But we also need to look into removing other aspects or other toxic foods, such as um, um, high sugars, caffeine, alcohol, and not just removing foods, but to remove any other existing gut infections. So if you do have something like candida overgrowth or SIBO or parasites, those are something that we need to also look into removing. Then the next R is replace. Replacing all the bad with the good. By removing the bad foods, we need to incorporate more good foods that can really help build and support the health of the gut and the gut lining. So this includes digestive enzymes, fiber, proper fruits and vegetables, and so forth. So supporting optimal digestion and nutrient absorption, as well as assisting your body's intestinal repair and also bringing down the inflammation. Next, we have something called reinoculate. What reinoculate means is to restore the bacteria that's in the gut, and the good bacteria specifically. So if for any reason we had to kill off any bacteria, whether that be because you had to take an antibiotic, then this is where we want to start off with reintroducing with high quality and high potency probiotics. And lastly, repair. Repairing the gut requires essential nutrients for the lining itself to repair itself. So these are nutrients such as glutamine. You might see glutamine as a common supplement in sports nutrition and bodybuilding, but glutamine is actually one of the nutrients that nurture the epithelial cells that line the gut. And there are other foods out there that really help with nurturing the lining itself, including bone broth, aloe, marshmallow root, slippery elm. So these are herbs that really help with the lining itself. Now, one of the most common questions I get then is, well, you mentioned gluten-free, but I don't have celiac. Why does it matter to me if I don't have celiac? Because when we think of celiac, we think of avoiding gluten. But if I don't have celiac, do I not have to avoid gluten? Well, leaky gut does not equal celiac disease, nor that if you don't have celiac disease, that you won't be affected by gluten. So it's not really specifically just the gluten, even though there's growing evidence that gluten can cause certain things that could damage the lining of the gut and the tight junctions. There are other components of the grain, of the wheat itself. So is it the gluten or is it the wheat? And that's something to also consider about, because in wheat, there's something called wheat germ agglutinin, WGA. And that's been shown to cause a release of chemicals from the immune cells that underlie the intestinal lining, and that itself could also contribute to a leaky gut. Then there are also starches, and you probably heard of the term lectins. And these are starches that are not easily broken down by humans and can actually feed the bad bacteria in the case of small intestinal bacterial overgrowth. So these are things to really consider when it comes to understanding about gluten, gluten-free, and etc. So to summarize, leaky gut or intestinal permeability is shown to be affected by many irritants and exposures in our environment, leading to this array of symptoms as if our gut becomes influenced by inflammation, that chances are that will get on to the rest of the body, whether that be to the joints, to the brain, etc. We can't change our genetic predisposition, but we can address our exposures, and that is through the 4R approach. And that concludes my talk right there. And before we actually finish off here, I'm going to stop the recording.